Hi, my name's Courtney and I'm a physiotherapist here at Vector Health. What probably got me into physio is a few different things. Like I grew up playing a lot of sport and so I was lucky, touch wood, I haven't really been too injured myself, but I had a lot of friends around me, you know, doing the typical sporting injuries, your ACL and things like that. And I just thought that would be really cool to be a part of that sort of journey and helping them with their rehab. But even just like the day-to-day, sort of seeing people with back pain, neck pain, and wanting to be a person that works with people and helping people. So I thought just putting that all together, that physio was a pretty good idea. And I decided that pretty early on in high school as well. So then all through high school, my subjects followed that line to make sure that I could get into uni straight away. And then here I am 3 years later working as a physio and getting to help people every day. So I love it. I think one of the best things about working as a physio is that you just meet so many people from all different walks of life. And at our clinic here at Vector, we just treat and see such a wide range of conditions. So I really enjoy working in like the pediatric space and the women's health space as well. I really enjoy working with geriatrics. One of my days I go into a primary school out in one of the regional towns about 2 hours away from here and work with the primary school age kids. And then I just get to see like the general musculoskeletal day-to-day stuff as well. So it's really hard. I still have my areas that I enjoy, probably being in the peds and women's health space, but I really just enjoy the day-to-day of meeting everyone that walks through the door and helping them and making them feel better in some way. There's probably a couple of things that stand out. The first one would be that I treat a couple of beautiful little kidlets, two separate little boys down in the Yeppoon clinic that I've pretty much been with since the get-go when I started here 3 years ago. Initially when they came to me with their sort of different conditions, they weren't sitting independently, they weren't crawling. We were sort of really starting with them as babies and working through all the gross motor milestones on the way up. Now, 3 years on, both of the boys are walking, running, and I think I still just pinch myself when I see them week to week, and now I'm having to run around the gym floor chasing after them. It's really just a nice moment and you really get to build such a nice relationship with the families as well. So that's really rewarding. The other thing that probably comes to mind is our Mums and Bubs program, which is something that I've also been quite heavily involved with for the last couple of years as well. And that's just sort of giving the mums like a safe space to come and exercise as well. A lot of them sort of note that when they come to our Mums and Bubs program, sometimes it's the first time they've left the house on their own with their baby. And so for them to be coming here and to be putting their trust in us for themselves, for their babies, that's never really lost on me either, which is just a really nice sort of part of their journey to be a part of as well. And when they're really grateful and they sort of say they've gotten so much out of the program and you've been the one that's been able to offer that, that's really rewarding as well. I think the third thing, rather than it being just like an individual sort of patient, is quite a lot. I'm just reminded that the education that we give people is really sort of so empowering. It's something that we obviously know quite well, but you're teaching somebody that doesn't really maybe have that much of an understanding of the human body or what's happening with their condition, how to make themselves better, and how to kind of manage their condition sort of moving forward. So I think I just really like the empowerment that I can give people with the education that we provide as well. Thank you so much for watching this video. Hopefully you feel like you get to know me a little bit more now, and make sure you go on and have a listen to the other clinicians' videos as well, because it's really a nice way kind of to get to know everyone in the clinic and find the clinician that's going to be the best fit for you. But if there is anything that you need or if any of this speaks to you today, feel free to give us a call and get in touch.